Our group will be presenting on the impact of the new healthcare law, Obamacare. Our group members are Catherine Ortiz, Santiago Mejia, me, Rebecca Morales, and Ana Ruiz. Okay, so the impact of Obamacare. Obamacare, the Affordable Care Act, or mostly known as Obamacare, is about to kick in next year, 2014. The general public is concerned and apprehensive regarding the changes taking place with Obamacare. It is important to analyze the changes and impact of Obamacare. Some of these changes will directly affect the families, the uninsured, and the businesses. The impact on family. Most families will be able to afford a healthcare plan. Plan will provide services that cannot be excluded, such as contraceptives in schools, health centers. This might be a risk of moral and ethical dilemmas. Impact on uninsured. Most uninsured individuals will be able to enroll in healthcare coverage by Medicaid or by affordable options based on income. Risk of lowering quality of primary care and leading to overuse of emergency room by Medicaid users. The impact of business. Government will push businesses by raising taxes to those who do not provide an acceptable health care coverage. Risk of transferring burden of cost to employees. Okay. Now we'll Rebecca will cover this part.
Hi, I'm Rebecca and I'll be talking about the pros of Obamacare. With Obamacare, there will be an increase in access to health care. Millions of people will now have the opportunity of having access to health care. Many will not be denied insurance due to pre-existing conditions. There will be health care at an affordable price. Under Obamacare, over half of uninsured Americans can get free or low-cost health insurance. Obamacare will offer new preventive services. All coverage starting after 2014 must include new preventative services and essential health benefits. This will help curb the growth in healthcare spending by eliminating the overuse of emergency rooms as the only source of care for the uninsured. Now I'll be reading part of Kathy's part of the presentation. She will be talking about the cons of Obamacare. Uncertainty of legislation. Legislation passed without knowledge of specific stipulations. President and top officials were unaware of specifications of Obamacare. President and top officials exempt from requirements. There will be tax penalties, steep tax penalties for not complying. IRS's power to reduce federal income tax reimbursement. There are few exemptions with Obamacare.
Hello, my name is Ana Ruiz. I will also be reading part of The Cons of Obamacare by Kathy. HIPAA violations, hidden source code. The cons of Obamacare can be providers blaming each other. Healthcare providers required to comply with HIPAA. Why not the government? Scammers, predators offering assistance in enrollment results in identity theft and illegal fees. Now I will be reading my part of the PowerPoint, which is the significance of Obamacare on the nursing practice. The law enhances opportunities for nurse practitioners and nurse midwives to provide primary care. The Obamacare will increase the amount of people who have access to health care, and this will result in an increased need of competent advanced nurses. ARNPs will be in high demand as primary care providers and as case managers for the burgeoning of number of people with chronic conditions. Interdisciplinary education for physicians and APRNs will be more important than ever to ensure communication among a primary care team. Greater emphasis in continuing nursing education. More nurses will pursue their BSN degree. The BSN nurse will take roles as case manager, discharge coordinator, patient educator, public health nurse, and community health nurse. And these are our references.